March the 5th, and I just want to check, make sure I'm all wired up here, but I've got sad news and great news. The sad news is we've lost 9 additional West Virginians since Wednesday. Yesterday we had our second day in a long time where we had 0 deaths. 9 is always way too many, but it is one heck of a lot better than where we've been in the past. I ask you to please remember these folks and not ever let 2,318 people in West Virginia become a statistic. I just ask you to join Kathy and I always in prayers for these great people. The 2,310th death is an 86-year-old female from Logan County. The 2,311th death, an 83-year-old female from Webster County. The 2,312th death, a 76-year-old female from Monroe County. The 2,313th death, an 84-year-old female from Raleigh County. The 2,314th death, a 62-year-old male from Wyoming County. The 2,315th death, a 71-year-old male from Jefferson County. The 2,316th death, a 68-year-old male from Monroe County. The 2,317th death, a 60-year-old female from Jefferson County. And the 2,318th death in West Virginia is a 93-year-old female from Wood County. Again, I plead with you to not let these people be alone. Not let their loved ones feel alone. Absolutely, we're all together. We've lost 2,318 West Virginians. Thank God we've only lost 9 since Wednesday, but it's still way too many. We're getting a lot better. Our reduction in deaths in the last 7 days, or 7 weeks rather, has dropped by 85%. It sounds wonderful, but it's still tough stuff on these 9 great families and these 9 great West Virginians. Yesterday marked a 1-year anniversary, and it's been one tough marriage, has it not? A 1-year anniversary, where I met with my administration and issued a state of preparedness for West Virginia in preparation for COVID-19. It's been one tough year. Absolutely. I thank you for pulling the rope, all of us pulling it together as best that we possibly could. Gosh, I don't know how I could look any worse, but I'm sure over the last year, I've gotten more white hair or lost white hair. 7 new positive cases in the last 24 hours. The daily percent positivity rate is at 2.54. It's been a long time since I've read to you 2.54. Our cumulative rate continues to go down. It's at 5.41 now. Our active cases are at 6,144. That's 48 straight days that our active cases have decreased in West Virginia. We have 124,502 that are recovered. And look at that top graph. It's amazing. It just keeps getting wider and wider, and that's what we want to have happen. We have 200 people hospitalized in West Virginia and only 55 in the ICU units. We have no red counties in West Virginia, and I want you to look closely at this map. It just jumps at you every way. Green, green, more green, the whole northern panhandle green. Absolutely, it is amazing the progress that we're making in West Virginia. I'm going to remind you over and over, if you're 65 years of age and you absolutely get any kind of sniffle, and that's what I call it, I mean anxiety, a headache, you're tired, please go get a test. These antibodies that we have, if we can catch this in the first few days, will absolutely save your life. Today, we're doing some additional lessening of our restrictions, and I want to go through those with you and everything. And today, we're going to move our restaurants and our bars to 100% of their seating capacity that they can use, provided we maintain social distancing. I encourage everyone there to just use good sense and absolutely, try at all times that you can to keep your mask on unless you're eating or drinking, and keep that social distancing. We'll have no standing room for people to congregate like in the bars and everything. This is 100% of their seating capacity. From the standpoint of our small businesses and retail stores, we're lifting the capacity limitation there. We do not see in our small businesses and retail stores a crowding or an issue there that causes us a problem right now. We absolutely expect you to continue to wear your mask and everything. We are not backing off of our mask mandate at this time. I truly believe, I can't stand these masks myself. I get that and everything. None of us can. But at the same time, let's don't get in a situation to where one robin makes spring, because one robin doesn't make spring. We're absolutely better. But when you turn around early in the spring, maybe even before now, and all of a sudden, a robin or two flies in and you think, oh gosh, winter's gone. Before you know it, you awaken to the god-awfulest storm in the world. We don't want to awaken to that, And so with that being said, let's just subscribe to the one robin doesn't make spring theory, and we'll get to spring. And absolutely it'll come sooner than later. Let's just don't get too anxious to lift everything away and then get some level of whiplash that really hurts us. As far as other venues, I'm also increasing the capacity limit for other businesses that still have capacity restrictions, like gyms, fitness centers, museums. They can go to 100% as well. Only again if the social distancing is done and done properly. As far as the gathering limit, we went from 50 to 75. Now I'm moving that to 100. And as far as our little fellows and girls that are playing travel sports and everything, I am also lessening the restrictions on all youth sports or youth travel sports unless you are in a red county. We have no red counties now. Youth travel sports may take place and everything in all counties unless you are in a red county. As far as our fairs and festivals, it's nearly spring. And in the spring and the summer, we'll be thinking about this. And I know that our fairs and festivals are hurting. We doubled up on the monies that we sent to our fairs and festivals last year. I was proud to be able to do that. And we're looking forward to being able to enable these events and these fairs and festivals to take place. So I hope you continue to plan for that to become a reality. And as we get closer, we'll clarify, the different guidelines and everything. But I'm very, very hopeful that our fairs and festivals will go on like they have in the past, and not just last year, but the past years before that. Our guidelines are all up. They're relatively the same, except for the changes that we've made today. And our mandatory indoor face covering requirement is still in effect. And I've announced the lessening of a whole bunch of stuff and everything, but nevertheless, we do continue to expect you to wear these masks. Again, I'm not a fan of the mask, but at the same time, we know they've saved a lot of lives. And we know we're early in the game. I tell this story all the time, but just think of it this way, West Virginians. You're walking through the woods, and you look 15 feet in front of you and there's a rattlesnake all coiled up, what are you supposed to do? What are you really supposed to do? If you jump to the left or jump to the right, or because you're not going to jump forward because you see the snake that's all coiled up in front of you, or if you jump backward, really and truly what you may do, you may jump on his buddy, because a lot of times rattlesnakes travel in twos. So really what you should do, if you had really good sense, is stand still, because the rattlesnake 15 feet away can't hurt you. And then look to the left and look to the right and look behind you and decide which is the safest way for you to go, and then go. That's all I'm saying. For right now, we're removing restrictions, and we're slowly deciding which way to go. Which way to go that we won't jump on a buddy of that rattlesnake and really have a problem. That's what we're doing. And we're getting there, and we're getting there quickly. So just hang with me there, West Virginia, and we're going to get there. You have some folks, and there's, and I completely respect this. I get it and everything, but some folks believe that wearing this mask, is, that they shouldn't do it and everything, from a freedom standpoint or whatever it may be. And I only ask you to consider, if you've seen how hard our National Guard has worked, how tirelessly they've worked, and through all that, I would ask you, have you not seen how the ICU nurse would go to work every day, hold the hands of 2,318 West Virginians that died, and saw them take their last breath? Just think as we go forward. Just be really considerate of all, and we'll get there. I am extremely respectful of all of our freedoms, but this has been one tough go of it, has it not? A vaccine distribution update is just this. We're at 91.4% administration rate of first and second doses right now. We'll get to 100 by the end of the week. And get this number. We have put in the arms of people in West Virginia 532,805 doses. Amazing. It is truly unbelievable. We have also added more pharmacies through the federal pharmacy partnership in addition to Walgreens. These pharmacies will begin serving West Virginians starting next week. The pharmacies included are in the Medicine Shop network of independent pharmacies such as Fruth and all them. We continue to lead the nation over and over in our administration rate. And just think, as I've said over and over, it is amazing to think that we were ranked 7th in the world if West Virginia were a country in how we've gotten this vaccine into people's arms. Our vaccine allocation announcement, is on Wednesday. I announced that we are officially expanded our vaccine prioritization to include all West Virginians over the age of 50. Now we've dropped our age to 50. We stepped up and we tried to help our kids, with pre-existing conditions that are 16 and 18 years old, through that from the standpoint of Moderna and Johnson & Johnson, that you've got to be 18. From the standpoint of Pfizer, 16. And those kids, that are with those pre-existing conditions, we have to try to get shots in those people's arms. And the other thing is we stepped up and I promised our teaching community and our service personnel and everything that we would get to them, the people under 50. We made that from 40 to 50 now. We're giving shots, and we're going to get them first, and then we're going to come right back behind that, and we're going to get to 30 to 40, and we're going to get everybody as far as those workers that are at our schools, because they've done phenomenal work, and we appreciate them, and that's what I told them I'd do. For those that are 65 and older that may possibly have not gotten your shot, understand you are still top priority and everything. Even though we're dropping to 50, we're going to still move you to the front of the line and get your shot in your arm. Okay, the vaccine scheduling system, all the pre-registering and everything. Now we have 336,000 West Virginians that have pre-registered. The counties that I've been, reading over and over, they don't have them in front of me right now, so you must be doing better in those counties that I've mentioned. A bunch of them are in the Eastern Panhandle, and I know Monroe was at one time. I can't recall all of them, but you must be doing better and better on that. The Saving Our Wisdom clinics are up and going in all 55 counties. You got to watch for weather updates and everything. And then I tell you all over and over, the proudest number of all is just this: 187,922 individuals in excess that are 65 years of age and older. 187,922. We have shots in somebody's arm. Now just think, that are 65 and older. Those people, not long ago, 6 weeks ago, thought that there was no chance that they were going to be able to get a shot until maybe April. We've got well over half of our total population in this state that's above 65 years of age and older, that have gotten shots. And they're protected. And a bunch of lives have been saved right there. Whether it's 10,000, 30,000, put a number on it. Put a number on a life. It's unbelievable. You can't do it. 108,941 have their second shots. It's great stuff. Great stuff. And congratulations goes out on all this stuff, always to the National Guard, to the community leaders, to the absolute local health departments, to our local pharmacies, on and on to DHHR and all of our first responders. Can you just imagine the job that we've done in this state? It is unbelievable, and way to go, everybody. Our COVID info line is up. Vaccine reminders is first and foremost. Your first defense is wearing that mask. Your second defense is get your vaccine, for crying out loud. I don't know how many times that I'm going to have to sit here and say, the danger of you getting a vaccine is so minuscule, it's unbelievable. But if you don't get the vaccine, the probability that you could end up getting this is high. And if you get it and you're over the age of 65, you're in real trouble. Real trouble. And so please go get your vaccine. This idea of people scaring you and convincing you that, well, I'm telling you right now, there's no way I'm going to take a vaccine, and blah, 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 blah. If you look at that, most of those people that have decided not to take a vaccine, they almost are on a mission from God to convince you to not take yours. Because some way, somehow, that makes them feel better. If we had just the, not necessarily oddballs, but just those that just decided that they're not going to take a vaccine, and they'd just not try to recruit everybody to go along with them, that would be one thing. But recruiting people to go along and then you going along and making a really, really, really grave mistake, that's no good. Continue to get tested. It's free. The free testing map's up. We thank Walgreens and Fruith over and over and over for all that they've done with their drive-through testing and everything. It's good stuff. We have 9 outbreaks in our long-term care facilities. We have 1 outbreak in our church community right now. It's changed. The county's changed to Nicholas. And so, we're going to continue to pray that we're going to be away from that outbreak there. And we really salute our church community and our assisted living communities and everything for all that they've done. It's been phenomenal work. Remember to keep that pew in between you and your mask on at church, and absolutely social distance and wash your hands. Just keep up the good work that's kept you right here and put you right here. At corrections, and we know how this fluctuates and goes. Once we get this dreaded killer in one of our correction facilities, it goes. We saw it in the beginning at Huttonsville. But corrections now, we have 278 inmate cases and 9 staff. The inmate cases include 210 of the 278 at the Western Regional Jail and 65 at the Southern Regional Jail. So, all the inmate test results are in except 2 for Southern. So from our face covering standpoint, I continue to tell you, wear your mask. It's not going to last much longer. Just have a little bit of patience. This isn't going to go on forever. Just remember what I said about one robin not making spring. Give blood, West Virginians. Give blood. You'll save a life. And if you've recovered from this dreaded disease, please, please understand it's a blessing from God above, and maybe you have a real responsibility to consider giving blood. We're going to have our town hall on today at 12:30. I apologize for canceling yesterday. I've got to tell you this, but and I'm not very good at this. I'm really not. Our little Boston Terrier that sleeps in our bed has done so for 12 and a half years and everything. Kathy called yesterday about 3 o'clock and said that they had her to vet, and the vet decided, has told him that he's going to have to put her to sleep. And so I didn't want Kathy just to be there, without me. And so I took off and went home, had to cancel 2 or 3 different things. So we're going to reschedule. We're going to go back today at 12:30. But like I said, I can be a tough guy about a lot of things, but I'm telling you, I'm not any good at that, and I really hated that. But anyway, nevertheless, we get awfully attached, and we consider our pets as children, and we love them with all of our soul. Anyway, thank you all so much, and we'll talk in just a few minutes. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And as the governor has said repeatedly, but also said today, that while we are grateful for the terrific response that we've had from each of you and from having the miraculous vaccines available that we have been able to immunize our most vulnerable part of our population. And the governor has outlined the reductions in deaths on a week-to-week basis that we've seen in 2021, and also the reduction in hospitalizations that we've seen. We still need to be very, very aware that this is not over yet. We saw 70,000 new cases in the United States yesterday of COVID-19, 525,000 deaths in the US, 2.57 million deaths around the world. And we know variant viruses are also part of the new equation. So as we continue to have the benefit of receiving more of these life-saving vaccines from the federal government, Pfizer, Moderna, and now Johnson & Johnson, which we want to get into the arms of as many West Virginians as possible. As the governor said, although we've opened up some of our priority areas to include 50 and over West Virginians and 40 to 50-year-old pre-K through 12 and higher education teachers and school service personnel, as well as younger West Virginians who have illnesses that put them at higher risk of dying or being hospitalized, that we want to make sure that we continue to serve each other in a way that has been so beneficial thus far during the pandemic, where we recognize, as the governor has said, save our elders, save our wisdom. These are the people that have the highest statistical risk of dying from COVID-19. So we want to make sure that we continue to prioritize first our oldest part of our population, working our way through our over 65-year-olds, then working our 50 to 65-year-olds, incorporating our essential school teachers and workers, and also incorporating people with these medical conditions. We've started to get some questions about children or young adults who have intellectual and developmental disabilities, or who have significant injuries, acquired or congenital, that require caregivers. And what we would say to anyone who is representing them, please feel free to be very inclusive in who you call about. We certainly encourage you to continue to work through the pre-registration system and process. Sometimes there may not be a perfect fit, so also take advantage of the hotline number. And Jordan, if you could post that up one more time so that we can make sure that everybody has that number. So you can call the 1-833-734-0965, and they can help you make sure that your loved one and that you as a caregiver also get on the list. But like we've done before, I really ask every West Virginian, as the governor just has and our leadership team does as well, to make sure that you are patient. We definitely want to get at everybody in the priority group, but we really do want to get at our oldest part of our population first and continue then to move through the list. You will get your opportunity, and we absolutely hope that you choose to be vaccinated when it is that opportunity, but making sure that we're being patient and serving each other in the altruistic, community-based way that has really allowed us thus far to have such a positive response to this pandemic. Thank you very much.
All right, thank you, Doctor. Next to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As Governor Justice pointed out, we continue to make strong progress with our vaccine rollout. We will be bringing on next week additional FQHC doses that will come from the federal pharmacy program that are additive to our total numbers. We will also be bringing on, as the governor pointed out, those independent pharmacies in the medicine shop chain. And they will be a big help to us going forward. There looks like about 59 of those that will come on. We're still waiting for the final number from the federal government. The other thing that we are doing and continuing to improve our capabilities is we know we've had some issues in the manufacturing, mining industries as we get those essential workers over the age of 50 with ability to reach those folks because of restrictions that they have with availability of cell phones during the day. So we'll be working with those industries and rolling out some mobile capability that will allow us to get to that other essential workforce that don't have phones available to them during the day. We're setting some benchmarks for ourselves. We know that in the over age 50 population, that if we can hit about another 315,000 West Virginians, that would put us at roughly 75% of that population as our overall percentage of population. And that is a significant number, as Dr. Marsh and Dr. Amjad would tell you, for those ability to continue to mitigate the spread of this virus and the many variants that we will be dealing with. Last thing I want to do is there have been some folks that have been exceptionally helpful to us this week and last week as we work through the challenges of balancing load across the 55 counties and those 28 counties that we had challenges with. Lynn Fruth from Fruth Pharmacy has been exceptionally helpful to us as we work with the pharmacy program and some of this. Mayor Duke Pearson from Ranson in Jefferson County has been absolutely exceptional at working through getting those shots in arms out there. I want to thank Senator Blair, Delegate Householder, and Delegate Espinosa for their work and working with me and with the Interagency Task Force and making those linkages, as well as Senator Jeffries, who's been exceptionally helpful to us this week. Last thing I'll leave you with, the governor's team has worked exceptionally hard to work with him and being able to do the things that we can do to get things back to normal, but balancing against the challenges that we still face going forward. So I appreciate Governor the leadership and keeping that balancing act going And I ask all West Virginians on behalf of all those people that the governor talked about that are on the front lines here to stay disciplined. Stay disciplined. We are close, folks, but we've got to stay disciplined. Thank you.
All right, thank you, sir. Secretary Bill Crouch with the DHHR and Dr. Ayn Amjad, our state health officer, are both joining us and are available for questions. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good morning, everyone. Good morning, Governor, and let me send my sympathies to you and Kathy on the loss of your dog. My wife is also named Kathy, and last July we had to put down our little dog that we had for 15 years. So I know what you're going through, and my prayers are with you and your family. The first thing I would like to ask is, you lifted all these restrictions, 100% capacity on a lot of different things, restaurants, bars, gyms, etc. What about high school sports? I know boys' high school sports is supposed to start this evening. Is that going to be up to individual school boards to decide on capacity, or are you lifting any restrictions there? And I'd like to have the doctors on the panel address their comfort level with the lifting of all of these restrictions and the efficacy of that.
Well, Mark, we're working real closely with the SSAC, and the SSAC is going to have, is constantly coming out with guidelines and everything on how people can, can come and, come to sporting events and so on. But, and I know they're working hand in hand with the local people, whether it be the local superintendents or the local health people as well. So we're going to follow the SSAC's lead on all that. And panel, on the second half of the questions, if you'd like to, anybody like to respond?
Sure. Maybe I'll start, and I certainly add in. Thank you, Mark. The governor has been very consistent and I think really very talented at starting to move the rheostat on opening and liberating some of the capacity issues, because we are watching all this very carefully with our epidemiology group, and we're not seeing outbreaks in these areas. And so certainly maintaining our mask discipline and having people wear masks, continuing with the mitigation measures, physical distancing and others as we can throughout these businesses that are indoor and as we've done in schools, and waiting for weather to get warmer when people can get outdoors, where things are going to be definitely even more safe, I think is a very, very responsible way to move forward. And the key is that we're constantly monitoring all of these businesses and all of these areas. And if we start to see things change, then of course the governor will move in the way that he has demonstrated, and I think we all have, that we are prioritizing the health, the well-being, and the lives of the people in the state. And so I am 100% comfortable and appreciate his touch with this, because I think that, as you go forward, every governor is faced with this challenge to maintain businesses and education, yet also, maintain the health of the citizenry. And I think the reason why West Virginia has done so well is because of the governor's judgment and leadership here.
All right, thank you, Mark. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I'm sorry to hear about your dog, Governor. That's a very tough situation as a dog owner and a dog lover. I can relate, so all my best to you and your family. With the expansion of the age for the vaccine prioritization, there are many questions that popped up in my email and my voicemail this week. So let me ask a couple of quick questions for you guys, and I apologize, there's two of them here. But one, just as an example, I got a message this morning from someone who said they have an 81 and 77-year-old senior citizens that are in their family. They have chronic illnesses. They've not been called yet. That's just an example of dozens of emails I've received from people who have elder relatives or friends or people they know of, or who are elder themselves. So what can they realistically do to try to find out where they are on this list, what their relative time to get a vaccine could or should be? That's part one. they're feeling very frustrated and angry. They don't know what to do. So is there anything they can do? And secondly, the homeless population has not been addressed recently, at least to my knowledge. So congregate shelters be vaccinated. Homelessness is increasing. They're seeking out help from different agencies to deal with the homelessness problem. And yet these people aren't vaccinated and can't really provide the services safely. So I apologize for the two-pronged questions, but if you could address those, I would appreciate it. Thank you.
Kenny, and again, Mark, thanks for the really nice comments you made, about our little dog and everything. But General, I think this question is all you.
Yes, sir, Governor. So Kenny, I fielded 6 of those that you described yesterday that came to me through the hotline. So if somebody in the age group has not received a vaccine, we know there are still challenges with the system, and the DHHR folks continue to work that effort every day. We continue to prioritize the age as the governor laid out. But if people have not gotten the vaccine in those age groups, call the hotline. Those calls come directly to the senior leadership. We push those to the county level, and the county level, in the case of the 6 that I got yesterday, was already on working those. We know the system is imperfect. We'll continue to work it, push those calls to the hotline, and we will work those. Related to your question about homeless population, I would tell you that the first 5 Johnson & Johnson vaccines that went into arms in Kanawha County, I believe yesterday, went to homeless West Virginians who are in congregate settings to attempt to address the thing that you're talking about. We are pressing every day to get to as many people as possible, and we continue to work, and we appreciate you bringing up and pointing out those things that we continue to need to improve and do better. Thank you.
Bill, if I could, if I could add one thing. Kenny, that's a great question. I actually spoke to our hotline, the director of the hotline this morning, and asked him to push to us any individuals who have been registered longer than 3 weeks in those age groups, so that we could, as Jim said, push those out to the county level and get those folks vaccinated. So we addressed that this morning in trying to make a change there to get those names up to us. So good point and an important one. Thank you.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. First of all, Governor, could you say when these most recent changes go into effect? And second, it seems like this further lessening of restrictions, it's largely the remaining restrictions that were on the books. So are there other things that you're anticipating looking at or tweaking in the near future, or do you see this as kind of the status quo going forward? Thank you.
Well, Charles, I guess we'll see. We continue to tweak as we go. We've still got more information on our fairs and festivals that we need to get out. We've got more situations, that we need to discuss, as time moves forward in regard to our mask. There's just lots of things that are out there, that we'll still continue to adjust, and I hope and pray things don't break bad and everything to where we would have to go back and put restrictions back on. Let's just continue to pray in every way that this thing will be gone. And it's been surely long enough and surely tough enough. But as far as the restrictions, when the restrictions are going to be lifted, I think midnight tonight is always kind of the best way for us to handle that. So that's what we'll do. We'll try to go with midnight tonight.
All right, thank you, Charles. Next to Brendan Tierney with WSAZ.
Good morning. This is Brendan Tierney with WSAZ News Channel 3 here. Governor, other governors across the nation have announced similar restrictions over the past couple of weeks, but also removed the mask mandate. So can you give us a little more insight on why you decided not to remove the mask mandate as other governors across the nation have done? And what metrics will you be looking at to possibly remove that going forward?
Well, Brendan, let me just say just this. First of all, you've got a governor here that's watching all the time what's going on all across the nation and all across the world. But absolutely, I'm not going to be influenced by, people that are out trying to do something from a, political move or whatever. I really want us to be back to work and to be back to play and to be back to school and all those different things as much as anybody. But it is my responsibility to lead us in the right path and be as cautious as I can be while still trying in every way for us to live with this terrible killer and get us back to as much normalcy as we can possibly get to. From the standpoint of the mask, I would just say just this. I'm going to continue to listen to the medical experts. They highly, highly, highly recommend at this point in time to don't just jump because others are jumping. Absolutely, I understand the frustration about the mask. I mean, I get every bit of that. But you didn't hire me to just get it. You hired me to act and to do the smart stuff. What could it hurt? What could it hurt if we could have gotten rid of this mask today and we put it off for 2 or 3 more weeks or a month? What could that hurt? I mean, really, at the end of the day, we know what the downside is if we're premature in jerking our mask off or believing that one robin that flies in is spring and winter's all over, and then it whiplashes on us and everything. That wouldn't be good. And so we're going to take it a little bit slow and easy, but we're going to hope and pray we get it right. We just don't do something to look good in the media.
All right, thanks, Brendan. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, sorry to hear about your sleeping buddy. A couple of different things. Number one, I'm hearing that Johnson & Johnson vaccine shipments will be shut down for about 2 weeks until they can get more of it made. And I'd like to have the general address that. And the other thing for you, Governor, is I know you were concerned about getting the kids back to school for a number of reasons, academics among them. Is there any plan going forward to how to catch those kids up in their learning curve? Some kids did okay with virtual learning. Other kids did terribly with it. Can you move forward without getting them on the same playing field in the future? Thank you.
Paul, I appreciate your comments and thank you. And I can positively guarantee that Superintendent Birch and all of the people that are working, in the state board and superintendents and teachers, everybody they are constantly working on exactly what you're talking about, catching our kids up. There are some that were able to handle the virtual learning. The sum, in my opinion, is not many, but they're not a high percentage. And we've got a lot of kids that are behind, and I know you've got a lot of really, really good people that are absolutely pushing the pencil and pushing their minds in every way to figure out ways that we can possibly move forward. And they're doing good work, Paul, but it's a challenge, that's for sure. And as far as General Hoyer, if he could jump in and talk more about the vaccine stuff, and because he's much better at that than I.
Yes, sir, Governor. Paul, we were notified yesterday by CDC that it will be the 23rd of March before we can place another order for Johnson & Johnson vaccine. So that appears to be your information appears to be accurate. We have 15,500 doses, but will not be able to order additional Johnson & Johnson until sometime around the 23rd of March as a part of our normal ordering process. Thank you.
All right, thank you, Paul. Next to Ben Conley with the Dominion Post.
Hello, everyone. I'm interested if the Everbridge system would support functionality that would allow folks to potentially log in and get information on the distribution progress, maybe including some information on where they're at in the system. If so, would the state consider implementing that?
General, it's you again, sir.
Governor, I believe Secretary Crouch would need to field this one, sir.
Let's go to Secretary Kraus then, please.
Thank you, Governor. Sorry. Yes, the system does not have that capabilities. Keep in mind the system we're using, it's like the other areas of this pandemic that we've dealt with. We are kind of building this as we go along. The system was not set up to do exactly what we're doing with it. It was certainly not set up for this volume in terms of appointments. We're doing over 70,000 appointments a week in West Virginia. I want to compliment the public in general for being patient. There are issues here. There are problems that we're working with. Interestingly, the problems change as we fix one, another one pops up. The issue right now is that seems to be the most prominent has to do with the federal push to vaccine directly to the pharmacies, and individuals are getting more than one notice for an appointment. So there is a place on there. It gives you options to say, accept the appointment, unavailable for the appointment, or delete the appointment and opt out of future notifications. So please do that. I'm sorry if that's an issue. But in terms of expanding the system and knowing where you are on the system, I want to say again, the system is not set up to do that. It's the ranges that we're looking at in terms of by age, 80 and over, 70 and over, et cetera. As I mentioned earlier, we have asked, I specifically asked this morning for individuals who call into the call center who have been on the system for more than 3 weeks. They're going to push those names to us directly so we can get those names to the counties and try to get those folks vaccinated as quickly as possible. We're also doing a reconciliation of the system that I think will help. That will be done this weekend. So I appreciate the question. The system is limited in what it can do at this point, but it is taking those calls, which we're really inundating local health departments and others, thousands and thousands of calls a day. So we've resolved that part, but there are other issues we're dealing with. So thank you for your patience, everyone.
All right, thank you, Ben. Next to Katie Coyne with the Charleston Gazette-Mail.
Thank you. Governor, with the restrictions that are being rolled back now, I know nationally we're seeing these new strains pop up. Some places are rolling back mask mandates. Our numbers are down right now, and hopefully they stay that way. Is there any point that we can set right now that would make us put those restrictions back in place if our cases start going back up, if we start seeing more infections, and unfortunately start to reverse this?
Well, there's absolutely points that would make us put the restrictions back on. I hope and pray that they do not come. And I don't know specifically what those points would be, but our medical experts are watching this around the clock, as well as all of my team and myself. And again, we've got to understand just one concept. There isn't a playbook, you know. Things are better. We have to, we know certain things. We know things are better. And we know that we've got to live with this. And we know we've got to work and we've got to go on and we've got to go to school and those kind of things. We know all that. So what do we try to do? As things get better, we try to do more. That's what we should do. And if things would happen to, as in my opinion, just whiplash and come back on us and everything to where we've got to slow down or put back in some level of restrictions, we'll do so. But I go back to this. I just hope and pray in every way that that's not the case. It'd be really nice if this thing just slowly moved its way out of all of our lives. And so, we're doing the very best that we hope we can do here.
All right, thank you, Katie. Governor, I'll turn it back to you.
Okay, I don't really have a whole lot of notes. I would tell you that 12:30 today, we're going to have our another town hall on the personal income tax. If you've heard, well, this is all laid on the backs of the poor or the middle income brackets and everything. Please don't believe this stuff. I mean, please do not believe this stuff. Look at the math. Just look at the math. You know, what we've done is we stepped back and we did significant cash rebates to those that were struggling and those that were the lower or the middle income or the lowest low of the middle income. And absolutely, the way we've got this thing set up, every single West Virginian is going to have a positive cash impact, and we're going to put more dollars in everybody's pocket. And at the end of the day, we're going to, in addition to that, drive opportunity to this state beyond belief. And if you listen to what somebody else is saying and everything, you're making a bad mistake. Now, we can't help you if you're smoking 20 packs of cigarettes a day, you know, and I'm only exaggerating to make my point, but if you're smoking 20 packs of cigarettes a day, you're not going to make it much longer anyway. So, you know, that's just not very wise. We hope to goodness that you'll take a real look at maybe curbing, you know, the cigarette intake just a little bit. And then the argument that may come up and say, well, you know, people will go across lines and buy stuff because the consumer sales tax is a little bit higher, or the pop tax may be an additional nickel. Just think just 1 second, just about one thing. And I'll be saying this in my town hall, but I want you to just think about one thing. In the state of West Virginia, we have lost population since 1950. In 1950, we had 2.2 million people in West Virginia. And today we have 1,700,000 and change. We've almost lost 500,000 people in West Virginia since 1950, while our entire nation has doubled in size. Doubled. What if West Virginia would have doubled since 1950? We'd have 4.4 million people in West Virginia. Now just think, we got 1.7 million. So if we've got 1.7 million and we want to increase it by 20%, even if we increase it 20%, we will just be at where we were in 1950. But now here's my question to everybody out there. Do you really believe that if we raise the pop tax by 5 cents, the pop tax has not been raised since 1952. 1952. 70 years, the pop tax has not been raised. If we raise the pop tax by a nickel and the population of West Virginia grows by 20%, is there anybody out there that really truly believes that we're not going to sell more pop in West Virginia than we would, than where we are today? Sure, there may be somebody that's driving across state lines and buying some pop and everything, but if we increase our population by 20%, are we going to sell more pop or less pop in West Virginia? And I will promise you, we will sell more soda drinks in West Virginia because we got more people here. We got more job opportunity here. We got more everything here. And that's only with an increase in population that is equivalent to get us back to where we were in 1950. Don't listen to the junk. Look at the numbers. Look at really and truly what's going on. We're trying to put more dollars in your pocket and put more opportunity on your table. That's what we're trying to do. Thank you so much.